This is the procedural video for setting up the urine collection and disposal system for hospitalized patients diagnosed with leptospirosis. In this setup, we are using the Smart Y adapter. If this is not available at your hospital, there's an alternate setup utilizing two three-way stopcocks. Be sure to use only IV drip sets and IV extension lines that do not contain flow regulators. Starting first with our three-way stopcock and our Smart Y adapter, you're going to attach the three-way stopcock to the male end of the Smart Y adapter. The extension line from the urinary catheter comes down to your three-way stopcock. The second port from your three-way stopcock connects to your urine collection bag. And your Smart Y adapter is already connected to the three-way stopcock, and you attach a large collection syringe to this. And lastly, your red port is going to connect to an extension line to go to a collection bag for disinfecting. So putting it all together, we're starting with 5 mils of iodine in our syringe. Our system is closed to the patient. And because of the flow regulators in the Smart Y device, when I depress the syringe, it is only going to travel in one direction from this flow regulator to my urinary collection line to the disinfectant bag. So you can see I'm pushing the plunger. It's all going in one direction into the urinary collection bag. It is not going up to the patient. It is not going up to the patient's urinary collection bag, just that one direction. So now I'm off to the patient with my stopcock. So when I go to pull back on the syringe, the only thing I'm open to is the patient's urinary collection bag. So when I pull back now on the plunger on my collection syringe, that flow regulator is going to allow flow only from the collection bag into my syringe. It's not going to pull back from that iodine line because that's protected by its own flow regulator. So just pull back, I get the urine. Be sure to account for any air in your syringe when you're measuring your urine volumes. And then when I push the plunger, it just naturally will go into the disinfecting bag. Okay, and so then you just repeat this process over and over until you've emptied the urinary collection bag from your patient and you've recorded the totals of your urine collected over that amount of time. And this is a way to keep all of that urine contained so nobody has to touch any urine.
Here is a successful lepto urine collection and disposal system. So we have our patient. The urinary catheter is connected to this line coming in, meets the three-way stopcock. Now with this stopcock, you have to make sure that you're paying attention to the way your stopcock is designed regarding where the arrows are. So in this stopcock, arrows mean open. So right here, it is closed to our suction system, but it's open to the urinary collection bag. So this is how the patient is going to be throughout the day. They're just peeing down the line. It's going into their urine collection bag. This is the lepto urine. Now when you go to measure, you will turn this off to the patient. So now the urine collection bag line is open to our suction syringe. I'm going to pull back. You can see urine coming into the syringe. And then I don't need to touch that stopcock again. Because I have a Smart Y, this check valve, the flow valve here, is going to prevent me pushing the urine back up into the bag. And what it's going to do instead is it's going to come up this line where the flow regulator is only allowing flow in this direction. So I'm going to go ahead and push, and you'll see the urine come up that line into the iodine collection bag. That is a successfully working system. No one has to touch lepto urine.
After you've emptied your urine disinfecting bag, be sure to refill the system with 5 mils of iodine per 1 liter of intended urine collection to disinfect the leptospirosis spirochetes.